Hi, my name is Terry Pollock, and I'm an educational specialist with Metametrix Clinical Laboratory. And what I do, I've been doing for years, and I help our clinician clients understand test results to help their patients. In the last few years, we've been doing a very interesting and helpful stool test. It's called GI Effects. And there's a misconception out in the marketplace that the PCR technologies that we use in our stool testing are not valid for stool testing. And stool culture has always been the way for, 50 or 60 years that stool testing has been done. And I'd like to address that misconception. In 2003, the 8th edition of the Manual for Clinical Microbiology, even then was proclaiming PCR technologies as the gold standards already for things like diagnosing infectious disease in the clinical setting. And so I'd like to talk about three main points about this misconception. And the first one is PCR paints a much more accurate picture of the microbial profile in stool versus culture methods. Because culture involves a growth medium, some sort of culture medium, where the stool sample is placed into a vial or container with culture growth medium. And by definition, changes begin to happen pretty much immediately. And in the time period it takes that specimen to get to the lab, populations really do shift. Versus using PCR techniques, you don't need to use a growth medium. You use a fixative that stops all metabolic activity. And virtually, in that same time period of getting that specimen to the lab, the profile of the microbes is essentially the same as it was when the specimen was sampled. That's a huge advantage. And the second point that I need to bring up is that in the colon, in the human colon, 95% or maybe even more of bacteria are anaerobes, which means they don't culture very well. You can't culture anaerobic bacteria without a huge amount of expense and time and effort, because by the nature of being anaerobic, oxygen will kill anaerobic bacteria, usually within 10 minutes. So it's not commercially viable to culture anaerobic bacteria. And with anaerobes comprising 95% of the colonic bacteria, that is a huge amount of information that's missing from culture techniques. And the third point I'd like to bring up is that culture methods, they really are sorely lacking in quantitative accuracy. That's one advantage that PCR technologies bring to the table, is that we can get clinically useful, valid, reliable data consistently. And even to the point of you can do a stool test using PCR technologies for their microbes on a patient, and a clinician could put them on a protocol of prebiotics and probiotics, high dosing of good quality products. We can retest that individual and actually see improvements in those numbers. Extremely valuable information for the clinician. So for more information on our GI Effects stool test and all the other tests that Metametrix does, I invite you to go to www.metametrix.com. And thank you for listening.